Hearing loss is not just for older adults, but it can happen at any age. October is Audiology Awareness Month, nailed it that time, and is the perfect time for a hearing screening.
It's a tough one to say. Joining us now is Executive Director of the Hearing and Speech Center, Marcey Ansley. Good morning to you.
Good morning. Thanks for having me. I appreciate it.
And so you were hearing about the HSC is seeing babies at 2 weeks old even.
We are. So we actually started as a pediatric center back in 1960. And so now in Kentucky, back in 2000, they passed legislation where all babies have to be screened at birth. And if they fail their newborn hearing screening, they need to go somewhere for follow-up. Wow. And we're one of those centers, and we do a test for the babies asleep so we can measure brain reaction and get a really good diagnosis on whether or not they have some hearing loss. So we start really, really young, so we have teeny tiny hearing aids for those little ones. Wow. And then our oldest client right now is 104, super sassy. So
better be
everybody in between, right? I'm like,
right.
I want hot pink hearing aids. I've already decided they have glitter on them now. So I'm like, I want glittered hot pink hearing aids when I need them. I've already picked them out.
So you make them fashionable.
So, absolutely. Absolutely. You can have fun. We were talking about shoes. So yeah, make your hearing aids fun.
As you should. Now, when does somebody need to come and see you out there?
Absolutely. Well, there's a couple of things that we like to say. You really need to make hearing part of your health care experience. So if you're getting your eyes checked every year, you get your blood pressure checked, you really should be getting your hearing tested. Our goal would be to have everybody, once they hit 40, to do a baseline hearing screening, unless you have concerns prior to that. So if you have issues hearing in certain environments, you're realizing you're saying what, huh, a lot, you're concerned that you might have some decrease in hearing, then we suggest you get a hearing test. But really, it should be part of your natural process of health care. Those, go to the dentist, go get your hearing tested.
Wow. Well, you threw out a magic number. She said 40. I just turned 40. So
well, congratulations. That's a good number.
So now I need to.
Now you need to come see us.
Now I need to come see you.
Come see it, yes. Yeah. And it's amazing because most adults don't realize that they have hearing loss because it is progressive. With kids, we can probably tell a whole lot faster because parents and teachers are constantly watching and trying to understand what the children are doing. But as adults, we kind of just take things for granted and go, oh, okay, and you gradually miss things like the sound of birds or the sound of a pop can opening. And in addition to, it's very social. So usually that's where most of the referrals are coming in, is because families are really concerned about, mom, dad aren't communicating well anymore. They're seeming a little bit more isolated, and we really want to get in front of that as quickly as possible.
I would imagine too, especially for children, when really fast you are seeing your child and having kind of regressing a little bit with hearing. That's terrifying.
We make sure that for every speech language evaluation that we do, we always do a hearing test first, because if you can't hear, whether it's a conductive loss, if you have severe ear infections or some kind of permanent hearing loss, we want to make sure that we can treat that first, because if you can't listen, you can't talk. Right. So everything's going to be muffled, so all of those things can be connected. So we want to make sure that our kiddos have that test also.
And how do we find more information to see y'all?
Visit our website, I think is the best spot, so hscky.org. So it's our initials, Hearing and Speech Center, Kentucky, because there's one in New York. So
okay, all right.
Don't go to that one. That's a bit of a drive.
Don't go to that one. But, and then we are very active on Facebook, so jump on Facebook and check out what we've got going on too. Awesome. So both places,
Thank you very much.
Thank you.
No problem.
Thanks for having me.
Absolutely.